Okay, let's dive in. We're going on a journey deep inside the human body into those twisting highways of our circulatory system because, there's a quiet revolution happening right now, one that's totally changing what we even think of as surgery.
So here's a question for you. How do you fix an artery that's 100% blocked? I mean, think about it. That sounds impossible, right? It's like trying to clear a highway tunnel that's been filled end to end with solid concrete. Where do you even start?
For decades, the main answer was, well, pretty drastic. Open heart surgery, a massive operation. But that's changing. Today, surgeons are becoming less like construction workers and more like expert navigators. They're using the body's own vascular highways to pull off these incredible repairs, all from the inside out. So what exactly is this problem we're up against? Well, in cardiology, that concrete-filled tunnel has a name. It's called a chronic total occlusion, or a CTO for short. And you can basically think of it as the final boss of arterial blockages. Yeah, this isn't just a little narrowing. A CTO is a hardened, complete shutdown of a vital pipeline. It's been sitting there for months, just slowly starving the heart muscle of oxygen. It is literally a solid wall made of plaque, calcium, the works. So, how in the world do you get through that wall without resorting to major surgery? Well, you need a completely different way of thinking and a very, very special set of tools. Tools that aren't designed to demolish, but to navigate. And this is where things get really, really clever. Cardiologists figured out that they don't always have to go through the blockage. No, they can go around it. They use this hidden pathway called the subintimal space. It's a potential path that exists between the layers of the artery wall itself, kind of like a secret service tunnel running right alongside the main road. And one of the most ingenious tools they use for this is called the Stingray system. I want you to picture a tiny, flat, winged balloon that can be navigated right into that secret tunnel. Once it's in place, it inflates and it orients itself perfectly. It basically becomes a stable launch pad, letting the surgeon find their way back into the clean, open artery just past the roadblock. It's like a GPS-enabled drill that finds the main highway after taking a planned detour. And get this, the technique they use is just brilliant. It's not about brute force at all. It's a super precise two-step move they call stick and swap. First, a special sharp wire makes a tiny puncture to stick back into the main vessel. That's called the true lumen. Then, it's immediately swapped out for a much softer, safer wire to complete the trip without causing any damage. It's just a masterpiece of control. But what if even that isn't an option? What happens if the blockage is located at the very entrance of the coronary artery? I mean, a real danger zone where any procedure, even a fancy one like this, could risk disaster. Well, a team of doctors at Emory and the NIH were facing exactly that situation with a high-risk 67-year-old man. And they had this radical idea. Instead of trying to clear the old, dangerous path, the ostium, which is the artery's main opening, they asked this simple, brilliant question. Why don't we just build a completely new one? And that question led to something called the vector procedure. It is a world-first technique that's honestly less like plumbing and more like architectural engineering. They created a brand new coronary artery bypass, and they did the whole thing with just catheters and wires fed up through the leg. No open heart surgery. The way they do it is just incredible. They basically build an internal highway overpass. They use a single wire as a rail that goes from the leg, through the heart, all the way to the aorta, the body's main artery. And once they have that guide rail, they can create a tiny new opening in the aorta safely away from the danger zone. Then they just connect a new vessel graft back to the original artery. It's a custom-built route for blood, completely bypassing the problem. And the result for the very first human patient? A complete success. 6 months after this futuristic procedure, the new bypass was working perfectly. What was once just a concept is now a reality. So this all leads to the next logical question, right? If human surgeons can become these expert navigators, could we teach an AI to do it even better? Maybe faster? Maybe more precisely? And it looks like the answer is a big yes. Researchers are developing what they call world models for AI. You can think of it like teaching a self-driving car. Instead of teaching it to drive one specific road, you teach it the rules of driving, how to handle turns and stops and obstacles. This AI learns the rules of navigating the vascular system so it can adapt to the unique anatomy of literally any patient. And the results so far are, well, they're stunning. The previous AI models, they had about a 37% success rate in these really complex simulations. The new world model AI, 65%. That's not just a small step, that's a massive leap forward in autonomous navigation. So, when you take a step back and look at all this, you see that these incredible innovations, the Stingray tool, the vector procedure, the AI pilots, they're all pointing in the exact same direction. We are literally witnessing an evolution in medicine. We've gone from an era of cutting the body open to an era of navigating around problems inside it. And now we're entering an era of navigating to build entirely new solutions. And just over the horizon, you can see it, an era of autonomous navigation, where the AI takes the wheel. And listen, this isn't just some experimental science fiction. This whole shift is becoming official, a recognized part of modern medicine. They're actually introducing new medical billing codes specifically for these complex navigational procedures. That's the stamp of approval right there. It's becoming the standard of care. So the big takeaway here is this. The whole concept of surgery is transforming. It's shifting from a science of cutting to a science of navigation. The human body is the new frontier for exploration. And it just makes you wonder, if we can build new highways inside the heart today and train an AI to drive them, what other impossible journeys inside ourselves are we going to conquer tomorrow?